And COVID has certainly had an effect on our hospital, on our bed management, and on our wider community. Ironically, not really from COVID, but the unintended consequences of COVID. So to give you an example, we've had very few patients admitted to Belford Hospital, or indeed transferred onward to Inverness, who have had COVID, or indeed who've been incredibly sick because of COVID. We have had some, there's no denying it, we have had death, but not on a scale that would be seen elsewhere in the larger conurbations. Where COVID has had the impact is the isolation and the need for people to either self-isolate, to shield, or to undergo tests and then isolate because of either a positive or equivocal test. This has had knock-on effect on the carers, on the people providing welfare checks, providing meals for our vulnerable elderly people, bringing them to day centres or lunch clubs, and even the social services or the physios or OTs themselves, their ability to deliver care in the community. It doesn't take much. It only sometimes might take one person not to be available for an elderly person not to get their check in the morning, or indeed to be assisted out of bed in the morning or put back into bed in the evening, or for the meal to be provided. And so that person, through no fault of their own, will decondition and maybe lie in bed all day or sit in a chair all day and not get the exercise or stimulus that they need. And we will be left with a situation where they have become so deconditioned that a hospital admission is the only safe alternative. And that's what we've seen a significant proportion of in coronavirus times, is the number of people who, through the fragility of the support services, both the paid for and indeed the voluntary sector, because we have to acknowledge a good many of the families will be providing unpaid care and support for elderly relatives, or it doesn't have to be elderly either. It can be young people, but with pretty chronic conditions that renders them a bit more frail or vulnerable. So that's been the largest impact that we've seen in terms of our admissions to the hospital, and indeed our bed flow and the difficulties getting people either back home or, if necessary, to long-term care. COVID has also hit very early on. At the start of COVID, the nursing homes were hit particularly badly. Not all of them, but some nursing homes were hit particularly badly, and this was a national phenomenon recognised, and we were no strangers to that. So that also affected our ability to discharge people into the nursing home when they needed long-term care. So as I said at the start, COVID, it's been the indirect effects of COVID, not the direct effects. I think, in 2021, as we are now, it's literally the hope that the vaccine will get us through this to a point where we can emerge from lockdown. I know other parts of the countries have struggled in certain areas or communities with vaccine uptake. I've been astonished at the uptake in rurality. People are, you're pushing against an open door of all ages, all groupings. The uptake has been phenomenal.